everyone. This is Mayor Nick Hunter, and honored to have some guests with me today to discuss a topic that's very important to this community, and unfortunately a topic that is in desperate need of discussion right now within our community. August 31st is Overdose Awareness Day. And so in preparation for that day, I wanted to have a conversation with some advocates locally to talk about that topic and some of the effects that we have seen, and unfortunately, some of the increases that we have seen in our area over recent days, weeks, and months. Let's start out with introductions. Tanya?
Hi, my name is Tanya McGee, and I am the Executive Director of Imperial Calcasieu Human Services Authority. We are the largest behavioral health provider in the 5-parish area, and we manage all of the state and federally funded substance abuse and mental health services, and as well as developmental disabilities for our 5 parishes. And I'm very glad to have this conversation with you, Mayor Hunter.
Thank you, Tanya. Appreciate you. Melissa?
Hi, I am Melissa Stainback with the Office of Public Health. I am the Opioid Outreach Coordinator for Region 5.
And Kristen?
Hi, thanks for having me. I'm Kristen Gonzalez. I'm the Harm Reduction Outreach Coordinator with Southwest Louisiana Area Health Education Center.
All right, ladies, thank you all for joining. So Melissa, can you give us a quick snapshot as to what we're seeing within the community right now?
Sure. I'm really happy to be here and happy to be part of this team that you see here. It's a great partnership. Part of my job is to look at the data and see where we are in terms of overdose, and we're really not in a good place. I work closely with the coroner's office and ambulance to get these numbers. So as a whole, just statewide, we know we're hurting. From 2019 to 2020, we've had about a 60% increase in overdoses during this pandemic year. On our Calcasieu Parish level, the jump from 2019 to 2020 in overdose deaths was about 45%. But this year in 2021, we're actually set to almost triple these deaths at the rate that we're going for 2021. The last I checked, we had 57, but I'm pretty certain we have more than that now for all of 2021. So that is already a substantial increase over the entire year of 2020. At this rate, our projected deaths are to hit around 125 for the year. So that'll be 140% projected increase since 2020. So we're not in good shape here. We also look at ambulance overdose calls. So these are really surviving overdoses. And we know those have increased at staggering rates as well. So my job's kind of the data, but the people who are doing the real work are the other two people on the screen, that they're actually on the ground trying to change this landscape and reduce barriers to services. So on that, I'll pass it off.
Kristen, let me ask you, with some of the startling numbers that Melissa just told us, do we think that this is pandemic related, maybe PTSD from hurricane related? What are some of your thoughts on the cause for this locally? It's
combined. So it's pandemic related, which we were already addressing and facing at the height of the pandemic. But after Hurricane Laura, we did see an increase in people returning to their drug use because of the living conditions that they were put in. A lot of our participants were found having to move out of their sober living homes because they were destroyed and returning to living in a car or living in a tent. And we know that substance use is increased because of quality of living, social and economical reasons all impact drug use. The state of drugs right now means that overdoses are going to increase as a result of social and economical trauma from hurricane pandemics. So yeah, definitely.
And Kristen, when you say the state of drugs, do you mean the actual content of what is in the drug itself? Of course, we always are hearing a lot about fentanyl and the effects that it's having on our community. And I applaud, Tanya, your agency. I know you all have tried to do some some PSAs to warn people about the dangers of fentanyl. But Kristen, is that what you mean when you say the state of the drugs?
Yes, Mayor, that's exactly what I mean, is the contents of what is in the drugs. So we know that for opioids, overdose is, I don't want to say normal, but yes, normal. But now we are seeing an increase in overdose in stimulant users as well. Things like cocaine and meth, overdose increases are surrounding those drugs as well.
Understood. Thank you, Kristen. Tanya, what are your thoughts on the matter?
So we've, worked in the field. I've worked in this field for over 20 years, and I've never seen it quite like this before. And I think it's exactly what Kristen said. It's the accumulation of COVID plus the hurricanes, just trauma after trauma after trauma. And that the fentanyl out there is a very scary thing. And the one message that I would love to give to the community is a lot of people kind of view overdoses and drug-related issues as that's a problem for folks that live in this certain neighborhood, or that's a problem for these folks in this certain situation. And this epidemic is truly affecting everyone in this community. It is not, and it's affecting everyone. And it's going to take the community to help us to get through it. I always share this story. I'm a licensed addictions counselor. I run some of the largest substance abuse facilities in this area, and I lost my nephew to overdose. So it can truly hit anyone. And I just have to applaud our Office of Public Health, our SWALAHEC, as well as Imperial Calcasieu. Us coming together to combat this is what's making this, we're going to have to make a dent in it, and that's how we're going to do it. Kristen and Melissa have been doing some amazing work, but it truly is going to be awareness across the community that this is affecting our entire community.
So Tanya, what are some of the steps that just an average citizen could do to help right now?
So some of the big things that folks just don't understand and don't see, let's take the opioid epidemic, for instance. Close to 80% of people who use an opioid for the first time get it from a family member or a friend, right? I just suffered a knee injury on a run a few days ago, and the first thing I was offered was a hydrocodone from a family member who, in good faith, had just had a surgery, knew I was in pain, and tried to give it to me. That blew my mind. But that is something that's common. And so folks understanding and realizing that prescription medication is your prescription medication. So just being aware that it's not just the heroin users on, like I said, certain types, it's everyone. I tell everyone, go and look in your medicine cabinet. If you're going to do anything after you have a conversation with us, medicine cabinet, throw away those Percocets that doctor prescribed you after you had your child. Go and throw away and appropriately dispose of these medications, because a lot of the time, especially our kids, what we're seeing with the younger, and I'll let Kristen talk more about what she's seen on the street, but I know in our clinics, when we see our kiddos coming in the door, it's because they went in grandma's medicine cabinet. So just being very aware about appropriate use of prescription medication. In addition to that is to help us spread the message. So like you said, Mayor Hunter, we did a lot of PSAs. We did a lot of work around fentanyl. People don't understand the lethal dose of fentanyl. And so when these folks are purchasing drugs off of the internet, off of the street, we have Kristen and our team use what's called a fentanyl testing strip, which they can put the testing strip on a pill and determine if there's fentanyl on it. And I'd have to say, Kristen, I think the last time you told me is that well over the majority of the ones that they tested had fentanyl on it. People don't understand what they're taking. And so we want you to be safe, and we want you to understand that we need to get that message out to say, everybody takes a role. Get informed and get educated about fentanyl. Get informed, we all have our social media pages. Public Health, SWALAHEC, Imperial Calcasieu, help us spread the message and get educated on opioid addiction is probably something that I can tell folks. And to know that treatment is available, but treatment isn't always where the folks are at. So sometimes to say that somebody went into the hospital with an overdose, throwing them, I don't want to say throwing, that's not the right word, putting them or placing them in an inpatient substance abuse treatment facility might not be where they are at that time. So let's maybe try to do some harm reduction with them and to try to get them where they can go. Look, Kristen's smiling. Get them where they need to be. So it's not always the same as we know treatment to be. They have a problem, they go into a 28-day rehab, and that's it. There's a lot of different things that we can do in response to this in terms of treatment wise.
Tanya, I appreciate your comments both on what we can do to help someone that's going through it right now, but also point well received about it's not only people that are currently addicted, but let's try and stop the cycle. And those comments you made about grandma's medicine cabinet, I've got a 4-year-old son. I mean, it makes me think even as a dad about those types of things. So that really hits home. Let's try and close out the conversation. Kristen, anything to add on just what an average citizen could do to try and create some more awareness or help their friends or family?
So I kind of operate in the in between is what I like to call it. So there's a spectrum, and drug use lives on a spectrum. And not everyone that we come into contact is ready for treatment, or not everyone that we come into contact is ready for detox or recovery. And so I think what we're calling on the community to do here, and as you heard Tanya speak on, is to implement harm reduction. We utilize harm reduction when we wear sunscreen outside in the sun. We utilize harm reduction when we wear our seatbelts before we get in our car and take off driving. We use harm reduction every day. I put my helmet on before I ride my bike. We know that illicit drug use is a part of our community. We know that it is harming our community, so we need to implement harm reduction. How can I keep you alive long enough to talk to you about possibly going into treatment? How can I keep you alive long enough to talk about recovery and detox? If I don't keep you alive, we may never ever see those days. So implementing harm reduction means accessing resources like Narcan, safer drug use information, meeting the community where they're at. And sometimes that is in active drug use. Sometimes that is not ready for treatment. Sometimes that is not ready for recovery, but that person still deserves to be alive. And that's what we are doing with harm reduction outreach. We are giving people tools, education, and linkage to care to keep them alive. We have a hotline. We have an outreach team that has outreach days at several locations. And as Tanya mentioned, that can all be found on our website, on our social medias, and just through engaging with us in our programs.
What is that website?
It's actually on Instagram. So our Instagram platform is SWLA Do No Harm.
Okay. Thank you, Kristen. Melissa, any final words to kind of close it out?
Sure. I just want to add that when I do go and give talks and education about opioid, I end with talking about the harm reduction program. I mean, I talk about all of our partners at the table, and that's what's going to make a difference. But I end by saying, as a mom and as somebody who has all the data in front of me, when and if it's one of my kids or one of my family members, they will have Kristen's card in their hand when they need it. Sometimes as a parent, we can't reach our kids or our family members, but Kristen is that person who's going to meet your family member where they are and figure out how to keep them safe and alive. So that's where I'll end. And I truly appreciate your giving this issue the attention that it deserves.
Thank you, Melissa. Tanya, any final comments?
Yeah, so I would just add to, you can also get additional information regarding if that person does want to access treatment. That's where we come in as the behavioral health provider. So they can access any information on our Imperial Calcasieu website, which is imcalhsa.org.
All right.
And
Ladies,
Mayor Hunter, can I just pipe one last thing in? I'm sorry.
Absolutely, go ahead.
Just to add on to Tanya's, there is evidence-based medication-assisted treatment available. So we know that when you have an opioid addiction, it's going to be very difficult to tackle alone. We know there's treatment that works, and MCAL can link you to that treatment.
Ladies, thank you for the work that you're doing. We appreciate you. God bless.